Hello again and welcome to my last video of the series. My name is Analiza Burgos, and in this video, we'll take a look at the storage area. Sterile storage is an area where sterile items are transferred once the items have been through the cleaning, inspection and packing, and sterilizing process until it's time for them to be issued. The handling and storage of the sterile supplies are amongst the most important function of the sterile services department. All sterile items maintain the integrity of the packs and prevent contamination from any source. Shelves are designed for freestanding racks or storage bays to allow easy access for the staff to operate. All staff working in the sterile services should change into clean outer uniforms, and correct hand washing procedures must be followed. After the sterilization cycle has been completed, we use a trolley carriage to transfer the sterile items to be documented and validated. The foot brake and the hand lock of the carriage is activated and used as necessary to avoid any injuries. Leave the items untouched on the sterilization rack. Sterilized packs are the most common risk of becoming contaminated within the first hour of sterilization. The operator will use the TDOC functions to approve or disapprove the cycle once they are satisfied that all load criteria have been met. The cycle parameters are selected including exposure times, temperature, and pressure of 134 degrees Celsius for a minimum holding time of at least 3 minutes. There are documentation requirements that must be recorded, such as the name of the operator handling and the releasing of the load, and the date and the time, the cycle identification, and the results of the physical, chemical, or biological used in the load. Biological indicator helps us verify that our sterilization is effective enough to kill all the germs that may be on the instruments. This process will help us to know that we can provide patients with the best possible care. After 35 minutes of cool down time, we check the filters and tampers are in place and if the chemical indicators has changed. Here is the abdominal set and ready to be dispatched. If any packs are dropped on the floor, torn, or have visible wet spots, they must be considered as contaminated, therefore should be replaced and reprocessed. The operator must have clean and dry hands before touching any items. Contact with moisture from hands will compromise the sterility of the stock. Items must be handled with care at all times. Once they have been checked, they will get sorted and dispatched. Items must be totally cooled down then packed inside within 2 hours of sterilization. The cover should be clear so that the details of the packs can be viewed. The items will be transferred to an approved designated area, which are placed on the COVID trolley, ready to be handed over to the operating theater assistant. Thank you for watching my video series explaining the safe sterilization work practice of a sterile technician.